to the pandemic, gonorrhea and chlamydia cases were going up constantly and significantly, according to state officials. News 3 Investigates wanted to know how COVID is impacting the situation. Take a look at this graph we made for you. Chlamydia cases are down more than 7,000 cases from last year. There's been a 10% increase in gonorrhea. Syphilis stayed about the same.
Gonorrhea cases are more likely to prompt someone to seek an STI care appointment because of the symptoms.
They say you may not have symptoms with chlamydia, so they don't think that there is less chlamydia out there. They just don't think people are getting tested as much in 2020.
People may have postponed their appointments, their regular screening appointments, due to concerns about being potentially exposed to the coronavirus.
They say testing for STDs at local health departments decreased in 2020 as walk-in appointments switched to scheduled appointments. News 3 Investigates uncovered that there was also a shortage of STD testing kits for several months as materials in the kits were used for COVID tests.
Especially early on, when the demand for COVID tests was really, really high, that there was a shortage in STI test kits nationwide, not just in Virginia.
Health officials say they've been working with community partners, continue to offer testing, and say much of the supply issues have been resolved.
The situation has much improved. I think it's almost back to normal now, so we're not really in dire straits anymore in that regard.
They say it's important to get tested and don't postpone your appointments.
Chlamydia and gonorrhea still remain very much treatable, and so is syphilis. So it's really important to get tested, even if you have no symptoms, and get treated if you're positive with the appropriate treatment.
We have a lot more resources on our website. Go to WTKR.com. I'm Margaret Cavanaugh for News 3.
Well, COVID is also causing fewer people to get tested for HIV. Testing decreased by roughly 20 to 30% in 2020 compared to the year before. The CDC reports 41% of U.S. adults avoided or delayed medical care due to COVID concerns. The pandemic also limited access to resources in order to make testing easier to get. The Virginia Health Department expanded an at-home testing kit.
People can go to our website, answer a few questions, and they can have a HIV test mailed to them. They perform the test in the comfort of their home, and they can have the results in as little as 20 minutes.
The health department says Virginia is teaching other states about home testing. Knowing your status is key to maintaining a healthy life and preventing HIV transmission. If you need more information about ordering a test kit, just check out this link at WTKR.com.